Many of our patients are concerned about their recovery process after LASIK and don't want to do anything that might jeopardize the outcome. This is certainly understandable. You will have made a large investment in yourself through doing vision correction surgery. It's wonderful to be able to see clearly without the thick glasses and contact lenses. I should know, I had LASIK on my own very nearsighted eyes many years ago, and I've performed PRK on my wife, my own mom, LASIK on one of my daughters, and the ICL procedure on my son. The LASIK recovery process is fascinating to me. Many academic papers show that there may be some healing after LASIK for up to a year. What we call clinical recovery, however, is more like 1 to 3 months. That is to say that after the first 1 to 3 months, your vision and comfort is generally perfect, if not a lot sooner. I have separated the recovery process into 3 basic categories: day 1, or the day of surgery, day 2 to 1 month after the surgery, and then month 2 to 6 after surgery. Immediately after your LASIK surgery on day 1, your vision will be foggy and blurry. You may be under the influence of Valium, which will hopefully help you sleep after your LASIK surgery. I always talk to my patients beforehand and give them just a few things to remember. But don't worry about remembering, because I will talk you through every step of the way as we go, and it's also written down. I also text all my patients my personal cell number after their surgery so they can get in touch with me very easily if you have any questions or concerned. I enjoy being accessible for patients so that if you're worried, you can talk to me directly. The numbing drops in your eyes for the surgery generally make you very comfortable immediately after the surgery. The numbing drops do wear off about 10 to 20 minutes after the procedure. At that point, your eyes will start to burn and water. This generally lasts 4 or 5 hours, but sometimes longer. A lot of patients the next day will still feel like there's an eyelash in your eye. We always give a tiny bottle of numbing drops to take home. The things I tell my patients immediately post-operatively are: go directly home. Don't try to stop off at the drive-thru or anywhere else. You won't be very comfortable, so it's best to get straight home and in your dark, quiet bedroom. We include a cold compress in your recovery kit for you to use on the ride home. Now, that won't last very long, so I recommend that you prepare for your LASIK recovery by having cold gel packs in the refrigerator or freezer. You can place the cold gel packs on your eyelids as you lie down and try to go to sleep. Often my patients tell me that they didn't sleep very well the night before because they were nervous. This can be a very good thing. If you can go to sleep when you get home, hopefully you'll sleep through the initial LASIK recovery of burning and watering of your eyes. You can also take ibuprofen, Tylenol, or a sleep aid such as Advil PM, Tylenol PM, or melatonin. We also supply comfort drops that will be in your recovery kit. These are numbing drops for the very short-term use in the first 4 to 6 hours after your LASIK procedure, so that you can get comfortable and hopefully fall asleep. In the first month, the recovery is somewhat variable. Most patients are seeing perfectly or near perfectly. The 2 most common reasons by far for the blurriness in the initial first month after LASIK are dryness. Almost everyone has some degree of dryness temporarily after the LASIK procedure. The symptoms can manifest typically as waking up with vision that's foggier than when you went to sleep, or having tired eyes along with increasing fogginess and fluctuation of your vision throughout the day, especially if you're on a screen for a long period of time. This is normal. These symptoms are generally more pronounced in women as compared to men as far as dryness goes. It's also a little bit worse as we get older. Typically in our late 40s and 50s, the amount of water produced in our tears decreases. The second reason for blurriness after LASIK is any residual prescription. If this occurs, we can do what we call an enhancement procedure to adjust for small amounts of residual nearsightedness, astigmatism, or even farsightedness. Overall, the chances of needing enhancement are less than 2% of all LASIK patients. In my practice, I wait at least 3 months to allow the eyes to heal as well as any dryness to resolve. The chances of you needing an enhancement increase slightly as we go into higher and higher degrees of prescription. There's also a slight slightly greater chance of needing an enhancement if you're over 40 years old versus if you're under 40 years old. It's quite easy to do an enhancement for LASIK. The recovery is similar, but generally I think it's a little quicker after the enhancement than for the original procedure. Now, after the first 30 days, any improvement is somewhat subtle and very slow. The most common issue is dryness. We can do additional treatments and therapies if your dryness is over the average. We do all our post-operative visits at no charge, and you have your surgeon's cell number for questions. At the 1-month visit, we generally measure the prescription just to make sure that you are seeing perfectly, and if not, we have those measurements for the 3-month mark if we're considering doing an enhancement procedure. At 3 months, the enhancement procedure can be scheduled, assuming everything else looks healthy. I hope this has helped to talk to you a little bit about what to expect at the different periods along the way after your LASIK procedure. Thank you.